I'm very happy to see many empty beds as we walk through here, particularly in this pod, which has been the ICU.
Dr. John Eick deserves a break, as do the many other doctors and nurses who've been dealing with the heartache and strain of COVID since the beginning. But don't for a minute think they have it easy just because more COVID rooms are empty these days. Many others are still full, and in the ICU, that usually means patients are on a ventilator. And if they're on a ventilator, that usually means they won't make it out alive.
I think the worst day that I can remember is having a young woman who was getting sicker and sicker, and having to have a conversation with her about if she were to go on the ventilator, that she probably wouldn't survive. Leaving her room and then figuring out her husband had just been admitted and was even sicker than her and already on the ventilator and not going to make it. And having to figure out how to tell her that he was here.
That patient was in her 40s. Dr. Eick has lost patients in their 30s with no underlying issues. That's what COVID does. Yes, older and obese patients or those whose health is immunocompromised are most likely to get very sick or die, but not always. Losing patients has become such commonplace, Dr. Eick says frontline workers have learned to compartmentalize their emotions, trying not to take home what happens at work.
Certainly not encouraging bottling everything up, but if you fully let all the emotions and feelings and tragedies sink in and affect you every single time, I don't think you can do this kind of job.
That's especially true since this Delta surge, because more than 90% of these patients now being treated are unvaccinated.
I've had a number of patients die over the past month that could easily have been preventable. So that part has been the hardest to me, is kind of being a little demoralized by it coming back even when we thought it was going away, and having more people dying.
He blames misinformation and mistruths for discouraging so many people from getting a safe, life-saving vaccine. Although there are exceptions.
There are a number of people, like a patient I saw today, who was interested in getting the vaccine here before she leaves just because she's homebound and hasn't been able to get out.
Despite the hard work, there are moments like this. Since families aren't allowed in a COVID ward, FaceTime has become the only way to see loved ones. On this day, a relative had arranged to have birthday balloons delivered, and nurses were all too happy to sing happy birthday. I have to say, it is a little unsettling to walk down these hallways, to see the patients on ventilators, to think about how many lives COVID has taken almost every day here. Dr. Eick hopes we don't take our foot off the gas, that the unvaxxed will get vaxxed, although he tries not to judge those who don't.
The way I try to approach it is not my job to be the detective and figure out whether or not they received the vaccine or make them feel ashamed of that at all. It's to take care of them while they're sick and while they're here.